This is Mayo Clinic Talks, a curated weekly podcast for physicians and healthcare providers. I'm your host, Daryl Chutka, general internist at Mayo Clinic in Rochester, Minnesota. Knee pain secondary to osteoarthritis is extremely common. The Center for Disease Control and Prevention estimates that 1 in 2 people are likely to develop symptomatic knee osteoarthritis in their lifetime, leading to significant impact on their health, workplace productivity, and economic costs. Well, how is osteoarthritis related to cartilage damage? Can cartilage damage either be prevented or repaired? And what role does regenerative medicine play in the management of osteoarthritis? We'll get answers to these questions from our guest today, Dr. Daniel Saris, an orthopedist at the Mayo Clinic. Daniel, thank you for being here today.
Thank you very much, Dr. Chutka. I enjoy being here, and it's wonderful to be able to address this important topic with you.
Well, you were an orthopedist. What challenges do you face with the current surgical approaches for osteoarthritis that really fail to address patient care?
Yeah, that's the big one. So I think the answer has 3 components to them. One is the expectations and the communication about what we can and cannot do. People have so much information available to them, and sometimes they think that we are capable of performing magic because the internet told them so. And in reality, we have some very good solutions for osteoarthritis in the right patient at the right time. Joint replacement is a wonderful option. But for very many young people who are facing the challenges of osteoarthritis in an early, very active phase of life, we still come up short with some of the traditional surgical options. And that's where regenerative medicine, where prevention, and where good communication about the realistic possibilities and some of the unlikely options that are there come into play. The second thing is new developments. So we have a wonderful collaboration in the Department of Orthopedics and Sports Medicine with the experts at the Center for Regenerative Medicine and our basic science experts within our own orthopedics department to develop new therapies. And they're aimed exactly at what you touched upon in the beginning, which is treating cartilage defects before they become arthritis, treating meniscus defects before they cause arthritis. And that is where the big change can be made. Prevention and early detection and treatment of joint damage, because that will help prevent the development of full-blown arthritis in younger patients.
Well, as an orthopedist, you are highly effective in treating those with advanced osteoarthritis with knee replacements. Those work great. And as an internist, I can effectively treat those with mild disease, pharmacologically and physical therapy and so forth. But it's that moderate group that medications don't really work that well. They're not quite ready for surgery. So I think we're really ready for some new treatment.